Okay, our next keynote, and then we'll have a more formal break. I'd like to introduce Dr. Marie Garcia from the National Institutes of Justice. Marie, I just met this morning for the first time, and so Marie's a social science analyst at the National Institutes of Justice with the U.S. Department of Justice. And likewise, I think Marie is representing corrections at NIJ. I know that her background is in corrections. She's spent time both as a mental health counselor at Valley State Prison for Women in California. So likewise understands both what it means to work in and I think understands that the corrections environment well. And now as a research analyst will be able to hopefully set a corrections research agenda at NIJ. So we're thrilled to have you here, and thank you so much for coming out. And we're looking forward to hearing your perspective and NIJ and DOJ perspective on corrections. So thank you. Advance there.
This one?
Let's see. She got that
Yeah,
queued up.
there we go.
Okay.
Great. Well, thank you so much. I wanted to thank Dr. Kale and Dr. Cherniak for everyone in the Symposium committee for inviting me to speak today. A lot of what I was going to talk about, not a lot, but some of the data and the research has been mentioned, so I'm on the right track. So that's good news. Can everyone hear me? Yes, okay. So I wanted to provide you an overview of NIJ and the Office of Justice Programs, which is where we're housed in the Department of Justice. I wanted to give you a bit of background on our research portfolios in terms of our historical review, and then kind of give you an idea of where we're headed in the future. And then, of course, I'll leave some time for some questions and answers. So OJP, I'm having trouble seeing here. Okay. OJP is one of several umbrella agencies in the Department of Justice. The mission of OJP is to increase safety, public safety, and improve the fair administration of justice across the U.S. through innovative leadership and programs. Now, in OJP, there are 14 agencies that are managed by our Assistant Attorney General, Ms. Carol Mason. And each agency plays a really key role in the contribution to OJP and just justice generally. And I'm sure this audience is pretty familiar with DOJ and some of the more core agencies to this key issue, but I wanted to just kind of give you a bit of background. So to your left is the Bureau of Justice. Is there a laser pointer? I cannot see the right there. Here?
Can you turn the lights on a sec?
Is this it? Here we go.
Oh, yeah, great.
Okay, so to your, there we go, left is the Bureau of Justice Assistance. Has anyone heard of BJA? I know John and Brian. BJA supports law enforcement, corrections, courts, victim services by strengthening the nation's criminal justice system. One of the most important things that BJA does, and they do a lot of, they're a huge agency, a huge budget, they do a lot of things. But one of the most important things that they do for the system is they provide training and technical assistance to our nation's law enforcement community, to corrections community. So they play a huge role in providing just assistance in programs and information to our criminal justice agents. Let me get this to work. Right next door, on the second floor, is the Bureau of Justice Statistics, and I'm sure everyone has heard of BJS. They collect, analyze, publish, disseminate information on a wide variety of topics. But specific to this group, they put out annual data on the number of individuals incarcerated at the mid-year and at the end of the year in our jails and prisons. They do a former prisoner survey and release those data every 2 years. They're working on developing a system right now where if you don't have, for jurisdictions that don't have a lot of data systems capability, you can actually create a recidivism rate based on the rates of counties and jurisdictions next to you. And that will be available to counties and jurisdictions in the I think the next year or so. And that's being run by Howard Snyder at BJS. So they do a lot of really interesting, imperative things to our understanding of what's going on in the system. And then right next door is where I am housed, which is NIJ. There we go. Okay, so here is a detailed view of our organizational structure. NIJ's director is appointed by the President of the United States. They are no longer Senate confirmed, which makes it a little bit easier to get them in the door. Our current acting director is Dr. Greg Ridgway, and unfortunately, Dr. Ridgway will be leaving NIJ at the end of the month. So we will have a new director in the next few months, but so it goes in government. Greg, or the director, is assisted by 2 deputy directors, and NIJ is comprised of 6 different offices, and 3 of which, let me get the pointer to work. These 3 I will talk about today. So our general mission statement is to provide knowledge and improve knowledge and understand the crime and justice issues through science. So what's interesting about NIJ is that we are the research, development, and evaluation agency of the Department of Justice. We are the only agency in the department who is tasked with conducting research on crime and justice. Now, the other agencies provide funding for technical assistance and training and program development, but we are the only ones who actually fund the research. So our aim is to provide objective and independent knowledge and tools to reduce crime, promote justice at both the state and local levels. And we do, as a federal agency, our mission and our mandate is to work with state and locals. But on the occasion, we do work and assess our federal partners, but we do a lot of work with them generally. So as I mentioned, we have 3 offices that conduct research on issues related to crime and justice. Now, I can't talk about what I do without talking about what everyone else at NIJ does. So our first office that I wanted to briefly talk to you about is our Office of Investigative and Forensic Sciences, or what we call back at NIJ OIFS. It's easy. OIFS is the federal government's lead agency for forensic science research. They develop and administer programs, they facilitate training, they improve laboratory efficiency, which is one of their key goals, and they reduce backlog. They have an extensive R&D program, and they do a lot of basic and applied research, and they provide direct support to crime laboratories and law enforcement agencies to improve their capacity to process high-volume cases. Now, one of the key things they've done in the last few years is provide a lot of training and technical assistance and funds for rape kit backlogs, which was a huge issue across the U.S., with some agencies having upwards of thousands of rape kits that they've not tested. So OIFS provided training and funds to be able to test these rape kits. So our job on my side, and I'll get to that in a bit, is assess what does that impact have for victims, for law enforcement? What do you do when you find hits? So that's kind of the social science part, and I'll get to that in a second. We also have our Office of Science and Technology, which is our S&T office. And one of their big missions in the states for the state and locals is to establish and maintain and performance standards for criminal justice. They have a lot of standards, for example, body armor for law enforcement, and we provide funding for research on on the body armor. They have compliance testing to support these standards, and they also provide technical assistance to practitioners, and they serve as a clearinghouse for information on technologies. When I first came to NIJ, I heard all these terrible stories about tasers and about their use on animals, and that just sounded so terrible. But when you understand the science and the purpose of it and its impact for law enforcement, you really get behind it. So as a cop's kid, I'm really behind it. So this is where I am. I'm in the Office of Research and Evaluation. Now, ORE is comprised of 2 divisions. We have the Crime, Violence, and Victimization Research Division, and they are really, and when I say diverse, they are really diverse. They are two divisions kind of put into one. So they do research on a wide variety of topics, including but not limited to elder abuse, teen dating violence, crime prevention, desistance, gang violence, geospatial research. So they do a lot of really interesting work in their division. And I am housed in JSRD, which is the Justice Systems Research Division. We are just as diverse, I will say. And I'll provide some more details in just a second, but I wanted to tell you something kind of interesting at NIJ that just happened is we have now a division of labor, this last point, between people like myself who are the social science analyst, and I handle and responsible for the management of research and its scientific merit. And we now have grants management specialists who handle the administrative aspects of grants. So for those of you who've had awards, know the budget issues and human subject issues, I used to manage that stuff. I don't have to do that anymore. Now I get to concentrate on the science and worry about planning and other issues. So those have been delegated elsewhere, and it's been fantastic. So again, I am housed in as a social science analyst in JSRD. And again, we are very diverse. We manage and conduct research on various stages of the criminal justice system, but mainly the point of arrest is where our research starts. So arrest, diversion, policing, courts, corrections generally, we kind of do it all. And the goal of our division is to pursue justice systems knowledge that works to inform the researcher and practitioner communities. So just to kind of give you an idea of some of the things that we do in JSRD, here are just a couple of examples of the research that we do and are doing right now. The first is the multi-site adult drug court evaluation. We have a really rich portfolio of research on drug courts. We're starting work on veterans courts, mental health courts, DWI courts, which I didn't know existed until my colleague told me about them. This particular project, I believe, was completed in 2011. It examined whether offenders who go through drug courts have reduced drug use, reduced recidivism rates, and other problems associated with alcohol abuse. And great findings from this project. They have reductions in drug relapse and criminal behavior, which was fantastic. The second bullet here, we are currently assessing the impact of incarceration on families. This is both maternal and paternal incarceration. And the key questions here are, for those families who are affected, who have a mother or parent, for children who are living with other family members, how do they access and use social services, public health systems, mental health systems? How do those systems work together, and how can we get them to work together? Because we know there's an interoperability problem with getting data systems to work. So that's one of the key issues there. The use of GPS to supervise high-risk offenders. This is kind of a really interested area for me. We've assessed GPS to supervise offenders in California that are high-risk sex offenders and high-risk gang offenders, and have found that GPS does work, but of course only as a short-term fix. And as mentioned earlier, with the police officer safety and wellness, we have started to develop a pretty large portfolio on this particular area. And I think it's important to this particular discussion because of the parallels between corrections and policing. But before I go into that particular area, I wanted to give you just a broad overview of some of the more specific corrections work that we do. When we speak of corrections, we generally speak of community corrections, institutional corrections, and offender reentry is kind of thrown in there as well, because it's one of the bigger outcomes of both of these particular areas. So the goal of this research is to just do research that works to give the supervisors in the community evidence-based policies and practices that work for managing offenders. And here are just a few examples of the research that we're doing and that has been completed. Has everyone heard of Hawaii Hope? Big program with Judge Alm out of Hawaii. Innovative court-based program used to prevent probationers from reoffending. This program in Hawaii had outstanding results. So in collaboration with BJA, we are doing a replication of Hawaii Hope in 4 sites in the U.S. And we're currently enrolling offenders into the program right now. And we're hoping that the evaluation will get started very soon. But, you know, research is so dynamic, you never know. The management of formerly incarcerated persons in the community, again, with technology, without technology, just trying to assess what works to kind of keep them out longer and have them be successful while they're in the community. Risk assessments are a huge part of the work that we do in community corrections. We're currently working on a project in developing a risk assessment tool as a short-term dynamic tool for juvenile sex offenders. So when we talk about sex offenders, we usually talk about adults, but juveniles are really, really overlooked in this particular area. So we're working with the Urban Institute to develop a short-term tool for these juveniles, and short-term in the sense that it's 6 months, because kids change so much at their age. Again, the use of technology in the community, we have GPS, we also have social media. We're currently looking at a smartphone app that pushes out information to parolees and probationers about employment. And we're trying to assess if the peer-to-peer works better than just Googling it online to find out what jobs are available in your area. And in fiscal year 2012, NIJ funded an executive session with Harvard University on community corrections. So twice a year for the next 3 years, 28 experts, both practitioners and researchers, will meet twice a year in Cambridge to answer and talk about important questions for community corrections. For example, something that I hadn't really thought about before is, how do we define the community in community corrections? It sounds obvious, but it was a day-long discussion, and I learned a lot that day. How do we define the community? Whom does that include? And what will this system of supervision look like in the future, with reductions in funding and staffing issues? It's a huge issue for the community corrections in the community. Okay, so our institutional corrections, which is a bit more, it's all relevant, but for this particular group. Our goal here is to build capacity, to encourage data-driven decision-making and policy, and to develop collaborative relationships between departments of corrections and researchers. And this particular portfolio is something that I do manage at NIJ, and a lot of my research looks at privatization of prisons, the impact of incarceration on families, and to be quite honest, our focus has really been on the offender, on inmates, which is why we're all here today. So here are a few of the projects that we have. Some of them have closed. Prison Rape Elimination Act in 2003, PREA was passed to curb prison sexual assault through a zero tolerance policy. We were mandated by Congress to conduct research on this particular area, and it was an interesting. This was before my time at NIJ, but most of that research has been completed. BJS does put out an annual survey of PREA statistics, so I actually keep myself in the loop on what's going on with that. Again, parental incarceration, institutional programming in terms of education, what works, doesn't work. We know, I believe it was Rand who came out with a study earlier this year that showed that correctional education programming does work in the facility. So that was actually quite interesting for us. Impacts of policies, early release decisions, California realignment. We're working with Joan Petersilia at Stanford University to examine the initial impacts of California realignment. Given the high number of inmates in custody across the U.S., we expect that we will start having other realignments, Ohio realignment and Colorado, that this is not just a California problem. And also the use of technology in the prison environment. We've looked at RFID, we've looked at GPS and other types of technologies. And of course, one of the big issues that we're looking at is cell phones and other contrabands getting into the facility and what impacts that has on institutional violence. This was shown earlier, so I won't go into very much. So according to the BLS, the rate of occupational injuries and illnesses for The U.S. generally was 12 cases per 10,000 workers. The time to recuperate from any type of illness or non-fatal injury was 9 days for COs, or correctional officers, I'm sorry. 459, their rates was 459 per 10,000. We know it's a dangerous job. We know that working in corrections is dangerous. Even more challenging is not knowing what will happen on a day-to-day basis. And as Dr. Kale indicated, I worked at a large women's prison in California before I started my work at Temple. And because of the growth of the inmate population in California, it's now a male facility of 4,000. It's 4,000 men, I believe. So I worked at the facility for 18 months before going to Temple. And my first few days, as Mr. Morrow mentioned, were, here's what to do in case a riot happens, because we're not coming in to save you because you're a civilian. Make sure your emergency contact information is on file because we'll need to call someone in case you get hurt. Here are the blind spots in the facility. Don't go there. Make sure you have food in your desk in case there is a riot and you can't go home for 3 days. Make sure you have supplies. Make sure you are ready to be here if you've got to stay. And I thought, dear goodness, what did I sign up for? But I will tell you, it was probably the best job I've ever had. NIJ is great. That prepared me for understanding the research we do at NIJ. So learning about the what ifs and the danger and the perceived risk that comes along with this environment, these statistics to me and to all of you, I'm sure, are not shocking. So generally, prison work has very low visibility. And again, I apologize. I know you all know this, but I feel like I've got to say it. It's physically and socially hidden from the public, except when there are big things that happen, riots, escapes, and other issues. And it leads some people to suggest that the work itself is not highly valued. Ethnographic accounts that I've looked at have suggested that staff view this work as misunderstood by the public. All of these factors really link to the worker health of the staff. And as Mr. Morrow mentioned, he said that and I thought, but it wasn't Oregon that called me. In the fall of 2012, I was contacted by a major jail system in the Northeast that experienced a rash of suicides. They had 4 in 6 months as opposed to 18 months. And it prompted a big discussion at NIJ about what are we doing about this issue. We have a diagnostic center at OJP that actually will work with jurisdictions on certain problems. And this particular problem that was presented to me resulted in a publication of sorts of a literature review on safety and wellness and what we've done at NIJ and OJP and the field generally. And the basic takeaway was we need to do more. So we know the stress, it's in a stressful environment. We know that you can't leave. I was told when I came to the facility in California, whatever problems you have, leave them at the gate before you walk into the Sally Port. Well, that's just not realistic. That doesn't happen. So bringing in your work stress, your home stress, everything else mixes to just a very stressful person, very stressful place. We do know the impact of stress on mental health and physical health, as already mentioned, blood pressure, hypertension, other issues, mental health issues. Again, the suicides, it's a sad statistic, but it's not surprising. So, excuse me. In December 2000, NIJ released a study titled Addressing Correctional Officer Stress, Programs and Strategies, completed by Dr. Peter Fenn. And it was our first step in identifying the breadth of the stressors in this environment and how to help treat and prevent this type of stress. Dr. Finn suggested programs to combat stress could save costs with regard to sick leave, comp time, improve officer performance, and concern for employees. The takeaway from this is it's been 15 years, and we haven't done much since. So I have just a few minutes, but I did want to talk quickly about some of the contributions of our policing literature and how it can help with corrections. Dr. Violante is in the room, so I won't actually say too much about the work that he's done, but his work on shifts and fatigues and the psychological well-being of staff showed that officer shift was associated with sleep problems. It was also linked to mental stress. Researchers at the Police Foundation did a shift length experiment and noted that there's a typo, not 80 hours. The 10-hour work shift in policing led to improved health improved performance. And the last study with the sleep disorders, they were found to be common among a cohort of police officers, and it linked to self-reported adverse health outcomes and performance and safety. So what we know from policing that extends to corrections is these things really do matter. Shift length, fatigue, health and safety, and it affects how one perceives their job and how they perform. So quickly, I'll just go over our next steps in corrections. We want to continue to parallel our policing research with corrections where appropriate. We continue to look at officer safety and inmate wellness. ADSEG, or administrative segregation, is a big issue in corrections, and it's something that we've been tasked with examining, so that's something we will definitely continue to look at. And lastly, this year in the spring, we released, in collaboration with the national academies, the growth of incarceration in the United States. Big report on what has happened in the U.S. with the prison boom in the last 40 years. What's interesting about the report is that it doesn't give us next steps, but it kind of takes to the water that it doesn't actually go there. So that's our job. That's our job as a community to kind of understand, what do we do now? So I want to go over I wanted to give you an idea about how NIJ makes decisions about what to do. We have our director who makes decisions about his or her interest. We have congressional mandates. Again, like PREA and the school safety, we have field-initiated research. We put out solicitations every year that say to the field, you tell us what's important. And then again, we have input from policymakers, from practitioners, scientific working groups, and other communities of practice. Our annual base budget is about $40 million. And again, the director has discretion in deciding how that money gets spent. Our forensic science research, they have between $100 and $150 million. Again, training and technical assistance, lab support. We have a lot of funds that are transferred from other agencies in OJP because they don't have the mandate to do research. They give it to us and we do it. And again, with the mandates, this particular year, Congress gave us $75 million to examine school safety. And given the prominence of this issue in the press and in the research community, we're expecting a pretty high amount of money next year in this issue as well. So here are just some of the opportunities that we have every year at NIJ to do for research that's relevant to this particular audience. This year we put out the research and evaluation on justice systems. This was open-ended. We also put out a Dear Colleague letter with this one to tell the community, this is what we're interested in. We want it all, but here are a few key factors that we're interested in. Our RPP, which is our Researcher Practitioner Partnership, this is a fairly new solicitation for NIJ in the last 4 or 5 years, but it's getting it's well received by the community, and the requirements for this particular solicitation are an academic university and a DOC or a police agency or some practitioner. They've got to work together on an issue relevant to criminal justice. And again, we have other opportunities, other directed solicitations that are maybe gangs or desistance, school safety, and our other offices put out solicitations as well. So I wanted to thank you for allowing me to come here and speak to you this morning. I hope that, at least in the short time I had, to tell you how important we really, I'm a corrections person. This is the stuff I like to read about, I like to think about, and I like that I get to do this work at NIJ. We have a lot of work to do in correctional office, especially with officers and other workers in the custody environment. So I encourage all of you to submit your innovative ideas to us in the next fiscal year, which starts in October 1. We'll have a lot of opportunities, I'm sure, because I get to help plan, and this is one of my really big interest areas. So thank you again for having me, and are there any questions?
Start with Dr. Storr.
Yeah. Hi, I appreciate your presentation. Really love NIJ. I'm a fan of your organization for many, many years,
That's nice to hear.
and use your research all the time. One thing I've noticed is there's a fall off in our information on correctional staff. it's very difficult to get even basic demographic information. You know, the number of women versus men employed, you know, military experience, racial, ethnic stuff, unionized, not unionized, pay. I mean, you have to go to the Bureau of Labor Statistics to get that stuff, and that's hard to parse out, and it's hard to get, you know, break down, and not the NIJ, this is more Bureau of Justice Statistics that's not providing this information anymore. My sense is, and I've been doing this for 24 years, my sense is that there's been a drop-off in this information, and that this information is really vital to this sort of correction, understanding organizational culture, the workplace itself. So how can we get more information on a national scale?
I do know that BJS's budget has been significantly reduced, as all of our budgets have been in the last 5 years. Since I've been at NIJ, our budget has been cut almost in half. So BJS has to really be, they really do, and they, more than us, they have specific mandates, like the Violence Against Women Act. They have very specific pieces of information they have to collect, NCDS, other types of data collections, but we do work a lot with BJS, NIC, ACA to pull that information. I know the BOP has their data. Their data is hard to get, but they do publish it annually. BJS really is the source, and it's unfortunate that you're not able to get the information that you need. But if I can help you, my information is up here, and if I can put you in contact with the right people. Because I know I wrote my dissertation on correctional officers, and I was fortunate enough to get the BOP's data, and they were really, really helpful. But it's hard. It's really, really hard to keep track of this population.
And that's just on the feds, though.
And that's just their
corrections is state and local.
right. And that was great because they're a unitary system of corrections, but and they have their own research shops, and it's great. But you're right, the jails and the states, it's difficult to come by. But if you want to talk more, you can get in touch with me.
Marie, that was great, and I just want to put this in context for the folks in the audience who aren't used to working in the justice system. One of the things that NIJ and the Justice Department has been useful for, especially in John's project with the B-Cops project, is a great example. And that's been funding the extra piece that wasn't on a NIOSH grant, for example. We brought the police fatigue issues into the stress and cardiovascular health and metabolic disorders that were being looked at. And so that was something that NIJ funded. And so one way to use NIJ and its sister agencies in justice is to help both leverage funding from other sources, but you've got contacts in the justice system, you've got communications capabilities for reaching out to practitioners, you've got funding from Bureau of Justice Statistics that can be used to translate research into practice out in the field and to get the kinds of technical assistance out to all the agencies once you've got the research done. And I think that's a way to think about all the organizational structure and things that Marie's put out. So thanks.
One of the things I didn't mention is that we do have another office. They don't do research, but they're as important, if not more important than us at ORE, is we have an Office of Communications in OJP, but they get to pick and choose what they put out, because if the AG calls and says he wants a press release on something, then that's what we do that day. But with us at NIJ, we have an Office of Communications where we can decide within the agency what do we want to tell our partners. And when we speak about partners, we're talking really about practitioners, the men and women who do this every day. You know, we have the researchers and the academics who do the research, but we need to translate that to practice. So we're really working on translational criminology and how to take these really 30,000, views, the 30,000 foot view into, here are 5 things that work for corrections officers. Here are 5 things that work for policing. So we're trying to kind of merge those 2 things in our communications office. So we're getting there. We're trying to leverage all of our resources and trying to, make it work for us. So hopefully our website is on there. our funding opportunity, our direct link is there as well. So please feel free to contact me if you have questions or look on the website.
Wonderful. Thanks so
Great.
much.
Thank
Maria.
you.